Hi, everybody. It's Teresa from the mayor's office. Just wanted to let you know we're on time, it appears. I think we'll get everybody by 11, so we should be ready to start around that time. Dr. Price, would you mind if I could just check your audio and your camera? That would be great.
All right, I should be unmuted and on video. Can you see me and hear me?
I see your beautiful face. Thank you so much, and thanks for being here today and for doing this. We really appreciate it.
Of course.
And if I could just get a quick roll call on who's on the line, please. And we're going to ask everyone, obviously, to mute and to, and I will go by just phone number if that's okay. So if you are the 2530697.
That would be me, Jacqueline Quinn with CBS Denver, Channel 4.
Okay, Jacqueline, thank you. 0784.
Marshall Zellinger at 9 News.
Hey, Marsh.
on, Mayor.
This one on?
Good morning, and thank you all for joining us for this update. Before we get started, let me take this moment to wish everyone a happy holiday season as we begin to close this week out. I am joined today by Bob McDonald, the Executive Director of the Department of Public Health and Environment, and Dr. Connie Price, Chief Medical Officer at Denver Health. Today's update represents an important turning point for our city since the pandemic hit us in March. That's because we've reached an important milestone of vaccinations in what we believe will be the final blow to COVID-19. As we approach the new year, that will be a major focus for me and my administration. So I want to share with you what those two priorities will be. The effective distribution of this vaccine to those in our community, and secondly, the full recovery of our community, both in public health and economy coming out of this pandemic. This week, we received the good news that the first shipments of the Pfizer vaccine have been delivered to Colorado, and the first of those vaccines have been given to frontline healthcare workers who have been standing in the gap for all of us over the past 9 months. Not only do we have the Pfizer vaccine, we are also eagerly awaiting the emergency use authorization of the Moderna vaccine. So we have not one, but two highly effective vaccines, around 90% effective for both, that are on the way as we begin to turn the corner in this pandemic. We know people have a lot of questions and on when they will be able to get the vaccine. As the governor outlined, dependent on supply, the vaccine will be distributed over 3 phases. The first phase we've all been talking about over the last few days are for those healthcare workers and hospital staff with direct contact with COVID patients, as well as those in long-term care facilities, and eventually expanding to first responders and other workers who have high risk of exposure to the virus. We anticipate phase 2 of the state's plan will happen in the spring for other essential and frontline workers, and then phase 3 of the general public in the summer. Again, this is all dependent upon available supply. We know there are some concerns about the safety of this vaccine, and there's a lot of rumors out there, unfortunately, attempting to undermine the confidence in the medical science and public health guidance. This vaccine is safe and has undergone rigorous testing and review by companies and advisors who produce them and the Food and Drug Administration, just like any other vaccine that is being produced for widely distribution in society. I know that I am personally excited to be able to receive the vaccine with the rest of the general public during phase 3. Now, as phase 1A of distribution is being sent directly to those facilities to administer to their workers and residents, we're planning now for phase 1B and phase 2 here in Denver, where local health departments, including Denver Public Health and Environment, will have more of a role in the distribution. Bob McDonald will be providing more on that shortly, and Dr. Price will be providing an update on phase 1 vaccinations, which will be occurring today with the Denver Health staff. Finally, as we've seen, our numbers are trending down, which is a good thing, and it's good news for all of us. And this it's a testament to Denver residents for keeping up with the precautions. But the bad news is that we still are at a level where those precautions must be sustained. With the vaccine not being widely available to the general public until the summer, folks need to keep up with the precautions that have been outlined that will keep us safe. Wear a mask, don't gather in large groups, and if you're going to be holiday shopping, please work to be conscious of doing it safely. I'm going to turn over now to Public Health Administrator for the City and County of Denver, Bob McDonald, for an update on our current numbers and vaccine distribution planning. Bob, welcome.
Thank you, Mayor. Thanks everyone who's able to join us this morning. I hope you're all doing well.
I'm going to share my screen here and run through some slides and then turn it over to Dr. Price. So let's take a look at the national landscape first. You know, Colorado, Denver, we're not alone in this. You can see that this is happening across the country, and we expected it during this time of the year with fatigue, with complying with public health orders. It's that time of the year when more people are indoors, and respiratory viruses tend to do better in this type of climate that we're in right now. You know, just a couple of weeks ago, Colorado right here was a very dark red state. So we still need to be very careful. This virus could turn in the other direction very easily if we ease up. When you look at the data that corresponds with where we are on that map, you can see over the last 4 or 5 weeks or so that our 2-week cumulative case rate has dropped by, well, it looks like about 600 to 700 cases, largely due to the additional restrictions that are in place. Before we're able to get to a less restrictive phase outside of the 5-star program, we would have to get down to 350 cases here. Where we are on the state style system, you can see still a very, very high case rate, twice as much as we were in the previous phase, and many times more than the spike we saw earlier in the year. Our positivity rate is good news. It is dropping, and hospital admissions are declining, but still at risk. Dr. Price can speak to that a little bit later. But staffing is a real problem at this point with our hospital care, our healthcare providers. You can see what's occurring around the state. These counties that are in red are not necessarily under the red level restrictions. This is indicative of where they are with their case rate. So you can see almost the entire state has a case rate above 350 cases per 100,000. A little bit about the COVID-19 vaccine facts, and I want to spend a little bit of time here as you're all reviewing this. I get a lot of questions about how can this vaccine be so safe when historically it's taken at best 4 to 5 years at best to develop a vaccine. And so there's this sense that this couldn't have been done safely. The research that's behind this vaccine has been in place for many, many years. There are many different types of vaccines. There are vaccines that are where the vaccine uses a virus, an actual dead virus, if you will. There are vaccines where the virus, a weakened virus, is used to make the vaccine. And then there are vaccines where a protein is used from the virus, and that's the case here. But the science behind that, the science behind using proteins to develop vaccines is not new. That's been under research for many, many years. And so this is not entirely new science that started when the pandemic began. The other thing that I want to spend a little bit of time on, just as a reminder, we touched base on this in a previous press update, but the virus that causes the illness that we all suffer from, we all know is called COVID-19. But the virus that causes COVID-19, scientists call SARS-CoV-2, meaning SARS coronavirus 2. And the reason that scientists call COVID-19 the virus that causes that, the reason they call it SARS-CoV-2 is because it's a very close cousin to the SARS virus that we saw over a decade ago. Severe acute respiratory syndrome. So in a sense, COVID-19 is coming from a very close cousin of the virus that we saw over a decade ago. And so when research went underway to develop a vaccine for this, scientists didn't have to start from scratch. The science behind this was largely already underway. And as the mayor pointed out earlier, very, very safe. In both of these vaccines, tens of thousands of people with both vaccines were, it was administered to tens of thousands of people, a very diverse group of volunteers, and very effective and very, very minor symptoms stemming from it. We're hearing that generally the symptoms that stem from it are after the second dose, but even with that, very minor symptoms of fatigue, headache that last generally for a day. And so we can't stress enough that this is a very safe vaccine. Now, I also hear that some will say, particularly those that are less vulnerable to this virus, that they don't want to take the vaccine because why go through that if the symptoms from the virus are not severe? And I want to stress again that many will be asymptomatic. Many people will experience minor symptoms, some moderate symptoms, but many will suffer severe symptoms. And it's not just immune-compromised people. I was reviewing an article yesterday about a 21-year-old healthy young male adult got the virus, had experienced minor symptoms, thought he was out of the woods, and then a couple of days later, he took a downturn and actually experienced some very, very severe symptoms, including multi-organ failure. That can happen. Those situations are very rare, but they are very real. So to think about, the gamble that someone could take with not taking this vaccine, those risks are very, very real. It's a gamble in terms of how that will turn out. We need everybody to understand that this vaccine is safe. We get out of this pandemic by reaching herd immunity, and we reach herd immunity through people that have already experienced the virus, but even more so by a large percentage of the population realizing that this virus is safe, that this vaccine is safe, and that they accept it. We are working on how the phases of how people will become vaccinated. There are tiers that are laid out here. This first tier 1A is already underway. I had heard that in one hospital setting, over 800 healthcare providers were already received the first dose. And we expect that through the spring, we'll move into the second tier. We'll communicate what those tiers look like. People will be notified that it's time for them to get their vaccine. And then through the summer, we'll focus on the general population where there's less risk. And hopefully through the end of the summer, we are doing well with this. And the end of 2021 looks a lot different than where we are now. But we need to stay the course. We still have many, many months in front of us. And again, it's going to be very, very easy if we ease up. It'll be very easy for this virus to get us back into that very dark red that you saw in the map earlier on. So continue to wear face coverings, gather with just members of your household only. We're moving into the holidays. We need to be aware of who we're gathering with, try to avoid those parties, keep hand washing. And remember that as we move into the holidays, if you're like me, you still got a lot of shopping to do. I've done some, but a lot of it I've done online. I think historically we all rush out to look for those things, to go store to store to see if we can find them. Think differently this year. Call ahead to see if they have it before you go to multiple stores. I found that when I've done that, it's less frustrating. I don't deal with traffic. I don't deal with parking. And it's a safer way to do the holiday shopping when during the pandemic. Consider, of course, calling and the store ahead of time, see if they have an online shopping for you, and use curbside pickup where you can. That's what's going to get us through this holiday season safely and get us through the pandemic even quicker in the spring and summer months. And with that, I will turn it over to Dr. Price.
Hello, thank you, Bob. So the Pfizer vaccine arrived at Denver Health yesterday at 7:20 a.m. All vials were inspected and arrived intact, allowing our phase 1 vaccinations to begin today. Denver
Doctor, can you
Health's
see your
role-
camera, please? I'm sorry to interrupt. Do we have your camera?
You should. Can you not see me?
No, we cannot.
I'm not sure why.
You just click up. There we go. We've got you now. Thank you so much. We can see you
Okay.
now. Thank you. Apologies
All
for
right.
interrupting.
Let me begin again then. The Pfizer vaccine arrived at Denver Health yesterday at 7:20 a.m. All vials were inspected and arrived intact, allowing for our phase 1 vaccinations to begin today. Denver Health's role in phase 1 will be to vaccinate healthcare workers and first responders. We define healthcare workers broadly to include groups such as environmental services, lab, radiology, food and nutrition, transport, and nurses, medical assistants, advanced practice providers, physicians, among many others. Denver Public Health and the Center for Occupational Safety and Health are actively working with our non-employee first responder partners to offer vaccine as soon as possible. We are excited to have a vaccine that is both safe and effective. In clinical trials, these vaccines were administered to more than 75,000 people who were closely monitored for any adverse events. No serious adverse events have been reported across all gender and race ethnicity groups and showed 95% efficacy in preventing COVID-19. The COVID-19 vaccine is administered just like a flu shot, which is typically injected into the big muscle in the shoulder. 2 doses are needed 3 to 4 weeks apart, depending on the manufacturer's requirements. Because the studies were done using 2 doses of vaccine, that is what will be considered adequate to achieve full immunity, although we do know that at least partial immunity is achieved after the first dose. These injections are given by trained healthcare professionals, and everyone receiving the vaccine will be monitored for reactions for 15 to 20 minutes after the dose is administered. It is important to recognize that these vaccines work well because they provoke a strong immune response. The response can cause some people to feel unwell for a day or so after the vaccine. For some, this is described as a feeling like a hangover or even a mild flu, and is more common after the second dose of vaccine. Other side effects include soreness, redness, or swelling around the injection site, fatigue, body aches, or headache. These reactions can be treated with ibuprofen or Tylenol if needed. The CDC's Advisory Committee on Immunization Practices assesses that this vaccine should be safe for almost everyone. The only precaution to vaccination at this time are for those who have experienced a severe allergic reaction or to a prior vaccine or some type of injectable medication. People with other allergies, like food or mold allergies, should be fine to get the COVID-19 vaccine. Since there are not enough data yet on the safety of COVID-19 vaccines in pregnant or lactating women and people who have a severely suppressed immune system, it is up to them, with the advisement of their healthcare provider, if they want to get the vaccine. Right now, vaccine is being offered in designated centralized clinic areas due largely to the unique storage requirements of this initial shipment, which requires ultra cold storage and very complex reconstitution protocols. As more vaccine is distributed and as storage requirements will be less stringent for future shipments by other manufacturers, we envision vaccines becoming more available to doctors' offices, pharmacies, and even mass drive-up vaccine clinics. From Denver Health's perspective, this is an historical day. This vaccine is a light to the end of the tunnel, a key tool toward ending this pandemic and saving lives, reopening Denver, and getting our kids back to school. While it is not an immediate fix, we do need to continue to mask, socially distance, and stay the course until we achieve herd immunity. This is that final piece we really need to get out of this. Thank you.
Thank you so much, Dr. Price. I want to introduce you all to our Chief Marketing Officer for the City and County of Denver, Jenny Schiavone. And our website has just undergone a big upgrade, and I'm going to let Jenny kind of walk you through where you can find more information on the vaccine and anything else. Jenny?
Sure thing. Thank you, Teresa. I'm going to do a quick screen share here. In addition to, of course, all of the great information and updates that the whole team here has been sharing, we've had our marketing and communications team across the city working to make sure that we're continuing to update and evolve our messages for the public and how easily accessible those are. So we've recently redesigned our COVID-19 website, as you'll see here. When you come to this page, you'll always see our current level of risk. as well as a message on, sort of how we're cleaning up denvergov.org during this time. What's new here is that we have a really easy to use sort of menu of the most important things that we know our residents are looking for: getting tested, now vaccination information, guidance and resources to help folks through this time for both residents and businesses, and then a one-stop shop for all of our public orders and response. As we go down, you'll see that we have embedded the data into the page, so that's easy to find as well. And again, just sort of a different way of consuming the information, with the idea that this is now more user-friendly, and also that the content and kind of our language has been broken down to be less government speak and more consumable for residents. Our testing page it has a really great update here. Not only can you look at regional testing information, but familiarizing yourself again and again as people question this, who should get tested and where you should go. Of course, the city has our own community-based testing sites, which do require registration, and now you can see where those are with a really easy calendar view here, which is a big improvement for us. And then another, of course, interesting portal here is going to be the vaccination site, which right now is really reflective of all of the information you've already heard today from Mayor Hancock and Bob and Dr. Price. But as we get further into what vaccination distribution and timelines look like for Denver, this will be a really good resource for residents to refer back to along the way. One other thing that I want to highlight is that along with the state, Denver continues to evolve our marketing efforts around COVID and everything attached to that. Something that that you'll start to see out in the ecosystem throughout Denver, in outdoor advertising and in digital advertising, arriving in your social media feeds, perhaps in your email inbox, on websites that you visit, will be advertisements for our new campaign, which we're calling It's Worth It. And this is really another way to get people to remember that while we are looking at a hopeful time with vaccines in sight, this isn't the time to let up. We still have many public health precautions and safety measures we need to take, as Bob and Dr. Price outlined. But this is really calling on some personal responsibility and connecting, your actions to the fact that maintaining your health, your family's health, is really worth it for not only continuing to get through the next critical months, but also as we move into vaccination periods, and really impressing on our residents and the people that we serve how important it is to stay the course, stay safe, get vaccinated, and really remember that this is all worth it and we will come out of this.
Thanks, Jenny. That looks great, by the way. So thank you so much for sharing that with everybody. I'm going to ask the mayor and Bob and Dr. Price to go ahead and come back on before we start with our question and answer. And Mayor, I'm wondering if there's anything you want to add or share ahead of taking questions.
You know what? Let me just say this out of the chute. I know that some of you all want to talk about the Thanksgiving travel. I know that would be a question you want to ask. But let me just say a couple things about that now, so that I can help you go on to, I think, the more important subjects. Human potential, as it is, with the potential to disappoint, and elected officials are no different. We tend to have moments where we disappoint and we make not very good decisions. Our judgment can fail us at times, and that's what happened to me over Thanksgiving. But I can tell you, there's nothing new here to report to any of you. I think it's important for us to focus on not only the progress we've made as the first city to issue stay-at-home orders, the first city to issue mask mandates, the first city to really have creative approaches to addressing small businesses, that implemented a wholesale relief strategy for our small businesses, our nonprofits, and those who are in danger of being evicted and having their utilities disconnected. I would rather us focus on the fact that city fed 140,000 families during this pandemic time, fed children every day to make sure that our children at least received a meal, and people receiving vaccines, and so many other things. We have a city that has used the fact that science has sustained. during all this. And it has been science that's guided us. And so that's where our focus is, and not taking anything away from the tremendous work that the people who work for the city, who have been implementing these measures, who have stood in the gap, like our medical health professionals, our public health professionals, our city employees who have remained online and on post to get us through this. And also to turn the page and begin to focus on what's next. This vaccine and making sure people are vaccinated, and we dispel myths, but also face the ugly truths about why some people, particularly people of color, would be concerned about taking this vaccine. Let's face it, let's address it, and hopefully assuage those concerns and get people vaccinated, and begin to have this economy turn from survival to thriving. And I think Denver has done that best coming out of the Great Recession. We know how to do it. That's where our focus will be going forward. So I just wanted to address that right out of the chute, and thank you all for being here. Let's go to Q&A.
All right, Mayor, thank you so much. And please remember to keep your microphones muted until you are called on. I'm not sure who was unmuting, but if you could wait until you're called on for questions. So we'll go ahead and start taking questions. Thank you.
Hi, this is Esteban over at Denver. This question is for Bob McDonald. It seems like the city's plan is very similar to the state's. Can you talk a little bit about the difference between the state's plan for the vaccine rollout and Denver's?
Well, I want to start out by saying, we want to be consistent where with the state's plan and consistent regionally. I think that makes sense, not just with vaccine distribution, but with public health orders and the like. So, I don't know that we can identify where there will be slight nuances. I expect to see that a little bit more in phase 2 and phase 3. Although, again, we largely want to align with the state and regional partners. What I can tell you is that as we develop those tiers, it's going to be based on science and public health. It is not going to be based on politics or who you know. And we'll be forthcoming with that information and communicate that when we have that delineated in our plan.
Esteban, thank you. Next question.
Hello, this is Meg Wingeter from the Denver Post. When you pulled up those numbers, it looks like we're nowhere close to getting out of level red. So do you think that there are additional things we need to be doing to keep driving that down, or just kind of keep doing this same level of precautions for however long this is going to take?
Well, I guess I'll take that question. Certainly the restrictions that are in place, it's demonstrating that it's working. But there are always things, more things that as individuals we can do. I mentioned some of that when I was talking about safe holiday shopping a little bit earlier. And certainly as the 5-star program rolls out, there are extra precautions that a wide range of businesses can take there. But at every step of the way, that the 3 primary things are, good hygiene, face covering, and small numbers with your household. And if we can stick to that, that's largely going to do the job.
Thank you. I'm going to take the next question from Vicente from Fox, and then we'll go to Marshall after that. Vicente, go ahead.
Yes, thank you so much. Mayor, will Denver County be applying for the 5-star variance program so that businesses can open under lighter restrictions? If so, when? If not, why? Thank you.
Thank you, Vicente. Great question. And I can tell you that absolutely we have every intention of applying. Let me share with you what we know. First of all, we recognize and acknowledge the fact that this is, at this point in time, life or death for many of our small businesses. We want to do this right. We recognize, as Bob pointed out, that our numbers could turn on a dime, and we don't want to do anything that disturbs or disrupts our trends at this point in time in terms of numbers going down. It's going to be an extremely resource-intensive effort. The reality is that Denver has more businesses that could apply for the 5-star program than any other city in the state of Colorado. Potentially 7,000 applicants are likely to come forward. And so we want to make sure that we have the resources concentrated and we have the ability to implement a program in a very efficient and effective and thorough manner, because we want to make sure that it's done right and not fast. But we understand this is the level of urgency that is out there. I have convened a working group internally. In fact, they're meeting even as we speak to begin the process of how we address this and pull together the application. We are very pleased that the private sector has leaned in and said, hey, we are here to help the city of Denver do this as quickly and as thoroughly as possible, and even with the assistance of some resources. So we are working through it now, and we want to do it as quickly as we possibly can, but make sure we're doing it right, crossing every T, dotting every I, to make sure we are, again, are protecting the health and welfare of everyone in those facilities, as well as the customers who come in there as well.
And Mayor, is there any timeline, any sort of date that you're looking at?
Anything I give you, if I gave you a timeline, would be inaccurate. We got to allow for our team to get to work on this, which they're doing. So no, I don't have one. I can tell you in conversations with the staff yesterday and on today, I said we want to do this as quickly and as efficiently as possible, but we got to make sure it's right.
Thank you.
Vicente, thank you. All right, Marshall, go ahead.
Thanks, Teresa. If you'll allow, I have a question for the mayor and a very brief follow-up to Bob, if I could. But the question to the mayor is, I saw an email from your assistant today that says you will be on holiday starting tomorrow through January 4th. The last time I saw an email like that, you traveled out of state. So I'm curious what your plans are for the next 2 weeks. Will you be leaving Colorado? Will you be having any large holiday gathering?
No and no.
And to Bob, do you feel a responsibility to become the face or more of the face of Denver's COVID-19 response?
No, I don't feel that responsibility. I don't know that I felt that from the beginning. I can't stress enough that, you know, this has not been an effort by the Department of Public Health and Environment. This has been a citywide effort. City Attorney's Office and General Services and Department of Transportation and Infrastructure and of course Mayor's Office. I mean, it truly has been a citywide effort, and we work very closely with our medical partners at Denver Health. So I don't know that I saw myself that way in the beginning, and I certainly don't now. I think there's a lot of credit that perhaps goes to this department that should be maybe spread a little bit more generally throughout the city.
Great. Next question, please. Does anyone else want to ask a question?
Teresa, this is Vinny at Bloomberg. Can I go ahead?
Hi, Vinny. Please do.
Hello. Good, thank you. This is Vinny Del-Giudice at Bloomberg News in Denver. Question for the mayor or the other panel members. With phase one of the vaccinations starting, do you have a count or have you any indication on the number of people, employees for DC Health, Denver Health, et cetera, have indicated they will decline the vaccine at this time, and if there would be any penalties towards these people that may decline the vaccine? Thank you very much.
Dr. Price?
Yeah, I'm happy to answer that. So we did a survey of our employees. We have 70% who indicated that they would be a hard yes on accepting the vaccine, which is actually very high compared to national standards. Another 20% who are still thinking about it, and then a 10% who declined for various reasons. Some of them may be legitimate reasons, some of them may be just fear of vaccine. As far as whether there would be penalties, no, there are no penalties for declining. The reason is that both of these vaccines are approved under emergency use authorization by the FDA. And I would question the ethics right now in mandating something that hasn't gone through that full approval. And although I have full confidence in its safety, I think to mandate something that has not been out for a standardized period of time or fully authorized by the FDA would not be prudent.
Bob, you have any thoughts on that? Did you want to respond to that question?
Not at this time, Mayor. I actually was thinking about some other things that I hope to get out in other questions. I apologize.
Let me make one comment with regards to that question in terms of the concern about people not wanting to take the vaccine, because I think it's a real concern that many of us have, really leaned in on here. At the turn of the new year, quite a few of us will be involved in really encouraging people to take vaccine. It's a real concern with some particular communities, particularly the African American community. The history is long and concerning. and one in which we're going to have to work hard to validate those concerns and also encourage folks to take the vaccine against those concerns. And so it's a big issue and one in which we should not dismiss. We have to validate it, and we have to spend a great deal of time raising the education and awareness about this vaccine and how it is critical. You know, my mother, I often talk about her, is 81 years old. I want her to take this vaccine. I want her to be protected. I want to do everything I can to make sure that when her time to take the vaccine is there, she is there to take the vaccine. And we need to make sure that throughout the entire community, it's in that way. We need to get to 75% of folks vaccinated so that we can return to some normalcy by the end of the year. And that's why it's going to be important for us to go to work and lean in and encourage people to take this vaccine and to know that it's not only about protecting yourself, it's about protecting those you love around you every day.
Thank you, everyone, and happy holiday.
Thank you.
Vinny, thank you. Bob, did you want to add something, though? I think it's important if you had additional thoughts that were triggered by what the mayor or Dr. Price had to say.
Well, I don't know. I want to dwell on it, but it gets back to the conversation or the question about me. Do I feel I'm the face of this? Now, I can't reiterate this enough that the mayor has been a leader in every way from the start of the pandemic. And it's not just under his leadership that Denver became the first city in this state to implement a stay-at-home order. To his earlier point, we became the first city to implement a face covering order. Our face covering order continues to be in place and more stringent than the state. Under his leadership, we were one of the first departments and still one of the few departments in the state that launched a public health unit to reach underserved communities. It was under his leadership that we launched the Pepsi Center that served the regional communities. He's devoted resources to this department, and we continue to be one of the few departments that has conducted tens of thousands of compliance visits because he's resourced us properly. So I absolutely am not the face of this, and we would not be where we are without that leadership. I just want to make that point.
Bob, thanks.
You, Bob.
Anybody else have a question?
Yeah, I'm Jackie from CBS Denver, and my question is just responding to the criticism that we're still trying to get the variances during a time when we're seeing red level, the dial on the red level, and schools are reopening. And so, you know, what do you say to those people who don't feel that any risk is really safe enough?
You know, we've got to keep, what I say is we recognize, just like with all of us, we got to keep the city moving forward. We got to keep people able to protect their lives and their livelihoods as well. We are seeing amazing destruction of people's ability to care for their families because of this pandemic. And where we have opportunities, any embers to allow folks to operate and to continue to take care of their families, we've got to look at how we make that happen. But let me also say this. I think there's another component that we need to be aware of. And I would invite Dr. Price and Bob to share any thoughts they may have on this. But I have spent an inordinate amount of time in the last few days talking to faith leaders, doctors, community leaders, public safety leaders, discussing what will be some of the remnants from this COVID that I don't think we have really felt the full brunt of yet, but we will. And that is the challenge of mental health. And as we shut down, stay-at-home orders came about, and people not only saw their livelihoods threatened, but there's a real sense of impact on all of our mental being and the trauma that we're all going through because of this pandemic. And we have to weigh that when we make decisions in terms of how we shut the economy down, how we send people home, that there is a real, not only real economic impact, but there's a real health impact as well on people. And we may not see it yet, but as it manifests itself, we'll see some impacts of it going forward. And I'm quite frankly, as I talk to these professionals, I'm embracing for that. And we're going to have to find a way. We are going to begin to think about how we address that from this point forward, but we have to think about that as well. I'll yield to Dr. Price or Bob if they want to share any thoughts.
Mayor, we already are seeing the impact of the isolation that COVID-19 has been causing for our patients and heightened need for mental health services. So I commend you for all your commitment to making sure these resources are available to Denver and continuing to address them in this next wave, which I think the next pandemic is a mental health pandemic.
Yeah.
And we stand ready to serve.
Thank you, Dr. Price. Bob, any thoughts?
Well, just I can't stress enough that, you know, this idea of the impacts of the pandemic, you know, we've had that at the forefront of our mind from the beginning. And in fact, when we were having conversations about implementing a stay-at-home order, you might recall very early on, we did not have a face covering order at that time. And when we talked with the mayor about implementing a face covering order, we wanted to do that in a timely way such that we could see soon that the stay-at-home order was going to be lifted. So we weren't having a stay-at-home order and a mandatory face covering order at the same time. So we're certainly, it's at the forefront of our mind, and we want to take a balanced approach to how many public health restrictions we have in place at a time.
But I'm encouraged to see that many of the school districts are looking at how they return kids back to in-person learning early next year. I think that's critically important. I met with a 4th grade class this morning on climate change virtually, and I watched the bodies and the language, body language of these young people online. Not only are they unable to sit still, which I was that way in 4th grade, but just their, the challenge of getting them to connect over the line. The teacher was fantastic, but I can see it can wear on them as well. So I'm excited to see here that a lot of schools or districts are looking at in-person learning for early next year.
Thanks, Mayor. We have time for a few more questions, so please refrain if you've already been able to ask a question and allow somebody else the opportunity.
Hi, this is Katie with 9 News. All right.
I'm sorry, go ahead, Katie.
Yeah, my question is just, if we stay on this current downward trend, what's the best estimate of when Denver could leave the severe risk level on the dial?
Bob?
Yeah, so, well, if you take a look over the last 4 weeks, it's dropped about somewhere between 600 and 700 cases, again, for that two-week cumulative case rate. So if we're at roughly 750 now, we need to get down to 350 at the current trajectory. I would estimate that it's 3 or 4 weeks. But remember, we have a holiday in there. We have a number of holidays in there. We have New Year's coming up, which historically people like to congregate and party. And we know that when there's partying, those public health restrictions, people tend to be a little lax with them. So hopefully everybody follows our guidance, and when we can get to that threshold in the next 3 or 4 weeks. That would be my estimate.
Dr. Price, did you have anything to add?
No, I remain also optimistic. Of course, in the hospital, we see a bit of a delay in what we all see in the community at large. We have patients who are still in beds in our hospital, so we're still feeling the stress of this wave. But for sure, based on what we're seeing in the community, we will also start seeing more patients get discharged. And I too look forward to, in a few weeks, that we may be down to our baseline levels. And then when we, to our lower baseline, nadir, I should say. And then when we have our vaccine start to be delivered, it's just more optimism that by late spring, early summer, we may be able to be hopeful for a more normal time.
Seth, I saw you coming online. Did you have a question?
I did, thanks. This is for Bob. There was discussion this morning at the city council meeting as to maybe give more priority to people experiencing homelessness and staff at the shelters in phase 2. I wonder if you can talk about that a bit more. Thank you.
Well, we certainly know that people who are experiencing homelessness are certainly an at-risk community with potential comorbidities. And then, for them to be in a congregate setting, there's an elevated level of risk there. We're going to prioritize that population just like we have from the beginning. Before we had our first case, We had staff members from our department going out with our wellness unit, going out on foot, trying to connect with people experiencing homelessness, letting them know that the pandemic is coming to Denver, that this virus is going to be in Denver. We were providing care to them, care packages to them, educating them on the precautions that they could take. And we're going to continue to do that, prioritize them and underserved communities through the vaccination phase.
Thank you, Bob.
If I can ask a quick follow-up.
Go ahead.
Do you know where in the second phase they're kind of going to fall in that prioritization or that hierarchy?
Well, it'd be towards the top of the second phase, and I apologize. We've made some modifications to it, and the state has made some recent modifications. I don't have it in front of me, but again, they will be prioritized just as we have from the start.
Thank you.
Lindsay, are you still on from the Sun? And did you have any questions? All right, we have time for one or two more. So anybody else have a question who hasn't asked?
I just wanted to.
Esteban?
Esteban again. Yeah, I just wanted to clarify. So there's going to be no changes to the current restrictions and public health orders in Denver. They will continue after Friday when they were set to expire.
Well, the current restrictions came from the state, and the city of Denver adopted them. It's my understanding that the state was going to review that at this time. I have not heard from them about what changes they are thinking of making, if they make any changes, but we hope to hear soon, because to your point, it runs through the 18th.
Gabrielle from Fox, did you have any questions?
Yeah, I think the mayor pretty much touched on it, but my question was really about, in the past, the mayor has been pretty vocal when it comes to issues in minority communities, such as voting. I know he teamed up with other mayors across the nation. Just wanted to know if there was going to be any targeted marketing for minority communities when it comes to trusting the vaccine.
Absolutely, and I'm recruiting some friends to join as well to help us to spread the word and to, quite frankly, spend some time in media and social media, having the very important conversation. We'll have some things that we'll announce early next year that we're working on, but yeah, there's going to be a very targeted push to really, again, raise awareness, face the reality of the concerns, and then encourage folks to be vaccinated.
Thanks, Gabrielle. Last question, if anyone has one. All right, again, thank you so much. Go ahead, Mayor, I'll let you get the final.
I just want to thank everyone for joining us again, and again, wish everyone a very happy, safe, and healthy holiday season.
Thank you, and thank you, Dr. Price, and thank you.